So our patient is ready. It is extremely important to have cleaned that area. So we have cleaned the area with antiseptic solutions. The landmarks that you need to identify if you want to inject a carpal tunnel properly. So first is this distal palmar crease. So you can see that now the two important tendons that you need to identify are palmaris longus. So if you ask a patient to do this, you will see this tendon popping up. So if I mark this area, this is palmaris longus. And if you ask a patient to do like this, you can see this tendon popping up. This is your FCR. So FCR here and palmaris longus. And the distal palmar crease. Now there are two ways you can inject the carpal tunnel. One is to identify palmaris longus tendon, and what we call is the ulnar approach, because you go from the ulnar side. So for this you identify our ulnar part of the palmaris longus. Take 1 centimeter ulnar and 1 centimeter down. Now this will be your point of insertion for your ulnar approach. For a radial approach, it's quite easy, and that is what I prefer. You just have to go in between tendons and roughly a centimeter proximal. Some people may say 1.5 centimeter, but 1 centimeter is what I would choose. If you have seen procedure for carpal tunnel decompression, you would know the landmarks. And normally if I want to show you where is the skin incision is straight. If you draw a straight line from the third web space here and coming up down here, so your incision is roughly here, and when you make incision will find median nerve directly underneath it. So if you go to the radial border of the ring finger, that is your incision for carpal tunnel. And the reason I use radial approach is because you have to angle your needle at roughly somewhere between 20 to 40 degree. I keep it around 30 degree. So if your angle is like this, so you would be away from the median nerve, and that is the reason I prefer to go in between the tendons, and I will be 1 centimeter proximal to the to the lower crease. I will show you how I do it. If you are doing an ultrasound guided, you can just give steroid 1 or 2 ml depending upon your choice. When I do it blindly, I always increase the volume so that even if you are not at a perfect position, it will spread and infiltrate and you will get a good result. So I am ready. This is my site of the injection, roughly 30 degrees, and just go straight in at the point which I have marked. If at any point if you are close to the median nerve, patient will complain of a sharp shooting pain, and occasionally you may need that. Now I am quite radial to it, so I am just going to inject slowly, just aspirate and then just go slowly, and you will not find much resistance. It is slightly discomforting for the patient, but if you go slowly, it's usually not that painful. It's always a good idea to aspirate and then go slowly. And now you can see that I am almost done. The patient has got some pain, but it's not very painful procedure. So this is our injection done, and this is how you inject a carpal tunnel. Thank you very much. Like, share and subscribe.